welcome to Book 101, where Book 101 is all about the books that I read for the last 40 years. And today I have my special guest. She's the author of the book Who Cares? No other than Miss Melissa Winger. Welcome to Book 101, Miss Melissa, and can you please introduce more about yourself?
Yes, thank you for having me. So, my name is Melissa Winger and from Minnesota. And this is my book. It's a personal journey with my son through the US healthcare system. So, thank you so much for having me.
Miss Melissa Winger, thank you so much for sharing your book to the world. And what does the title Who Cares represent in the context of your book?
So, there's a little story behind it. So, there is my son who was born with a rare chromosome disorder back in 1996, and the sort of trials and tribulations of having sort of a lifelong patient is how I kind of like to talk about it, where he has had numerous surgeries. Every part of his organ systems were not formed correctly. So we have spent a lot of time in the medical system, in the medical world, and this was the name came out of an interaction with my son's pediatrician, and I had been extremely frustrated. And so I basically, he said, "What would you like me to do?" And I just said, "I want you to care. I just want someone to care." And I thought, because if you just cared about the situation or my son, then you would go the extra mile to help him. So that's where that comes from.
Totally agree with you, Miss Melissa. Why do you believe the patient experience is so often overlooked in healthcare discussions?
Hmm. Yeah, so that's another reason why I had to write this book is I wanted to read a book like this, and it just really didn't exist. There are books about the healthcare system, about health reform, about the ins and outs of how to navigate the healthcare system, but those were mainly written by politicians or economists or physicians. And I wanted it from the patient perspective. And so I wanted to combine my our personal journey, all of the various things that had happened to us when going through the system, but then also tie in the actual research and the data and all of the history behind why are things like this, like in terms of patient safety. Some medical errors would be happening, and I wanted to know why does this occur? Why does this happen? What is going to be done to prevent it in the future? What systems are in place? So that's where I had to just put the whole book together from the patient side and how we go through the medical system.
Miss Melissa, what message or change do you hoping to spark through this book?
I want there to be more of the patient's voice represented in all of health reform. We see a lot of representation from providers, healthcare workers, even some of the healthcare unions, politicians. We really miss that patient voice, and in a sense of not just sort of complaining, right? Because they think if something happens to a patient, that they might be trying to file a malpractice suit, they might be trying to do other things just to rectify their own personal situation. But there are so many of us, especially that have to work with the system on a daily basis for years and years and years, that want to partner with the reform efforts that are being done and the changes that are being made. So we can put our voice in to say, hey, this is really what matters. Maybe it isn't the things that they think are important, really may not even have an effect on a patient. So let's say they redesign a waiting room in a clinic. This is just a little tiny example. How many physicians and the staff in that clinic actually sit in their waiting room? Like, never. So it's like, why can't get a patient in who
Never.
actually spends minutes, hours in the waiting room to get their opinion on how it should be designed? So those types of things we're missing.
Miss Melissa, who do you think most needs to read this book? Patients, healthcare providers, or policymakers?
I think it's a combination of both. I think patients like myself would have liked to have read something like this to not feel alone, like you're maybe struggling with an issue and within the healthcare system, and you think, why is this happening to me? Am I doing something wrong? And it's not usually the case. It's that the system wasn't designed to necessarily make it easy for you for some reason. So it's sort of like, hey, you're not alone, but then also it's a call to action to say we can't sit by and let all of these things happen to us. But we are at a severe disadvantage because we are usually the patients or the caregiver of a patient. And we are going through a personal battle just to survive every day. And so, how can you take that extra step because you're just trying to make it on your own to then help other patients that are in the same boat? So, if you think of this population of who it affects, they tend to be very sick, they're weak, they have no energy to advocate for themselves, let alone for a cause. So this is really a group that doesn't have much of a voice, and there needs to be a call to action.
Indeed, call of action, people. So let's talk about the exploring and patient experience. Miss Melissa,
Mhm.
what were some of the most shocking or eye-opening stories you uncovered while writing this book?
There was a lot of things that I did not realize, and a lot of those were about. One example would be how emergency medical systems in the state that are different compared whatever city you're in or whatever county you're in or any state that you're in, it's operated differently. And I usually go to the example of, you think you're in McDonald's. You're McDonald's in the Minneapolis, or you're at McDonald's in Arizona. Chances are the menu items are going to taste the same, right? But
Yes.
not the case in America in the emergency medical system. If you dial 911, it's going to look very different, and it can be just down to the minute city that you're in. And you don't know that there's a problem with the system unless you're working in the system or you happen to be that 911 call, because nobody really looks at it before then because they don't think it's, you don't want to focus on, I'm going to have to call 911 someday, because you hope to never have to call 911. So looking at that and seeing, wow, the emergency medical system, the training, the equipment is lacking in pediatrics. Like, they barely have any training available in pediatrics. There's not really pediatric equipment in an ambulance. And it was just like, wow, why is that? And so going back now, I happen to work as a volunteer advocate for getting ready for pediatrics in all um, the ambulances, and then as well as the actual emergency rooms themselves. So it's like those things that you just don't realize until you're faced with the situation.
Very well said, Miss Melissa. Very well said. How do you define a real patient experience versus the version of many institutions present?
Mhm. I so if we look at each and every system, and when I say like healthcare system, I'm saying there's the hospital level care, there's the clinical care, there is the home care, there's medical equipment. So that's what I mean when I'm looking at systems. And as a provider, you are not working necessarily with all of those systems. The patients are. The patients are leaving a hospital, then working with the home care system. And my book also looks at the entire lifespan. So it looks at the experiences that I had prenatally and what that looked like as a teen mother too, by the way. So it looked a little different than your typical a mother experience or parenting experience. But then I go all the way to long-term care. So it's our experience now with my son is in a group home because he's now 29 years old. And I cover the experiences of all of that, not just one illness, one hospitalization. I go through the whole gamut of everything we've been through. And it just looks different from a provider perspective because if you think of just even a hospital stay, your nursing staff, they're coming in and out. Their days are done after 8 hours. They get to go home. Where in some cases, especially if you're dealing with a very long hospitalization, we live there, especially as parents. We're living in that hospital room day in, day out. It becomes our second home. So to have that experience versus the experience of a staff person or provider that actually gets to leave that environment and go home to their own families, it just looks a lot different.
Ms. Melissa, what do you think are the biggest barriers to empathy and understanding in today's healthcare system?
I think we are at a stage where everybody is frustrated, not simply the patients and their families. I think the providers, the caregivers, are also very frustrated with the system. And instead of attacking it sort of at different perspectives, I think we need to partner, join together, and work to fix those experiences that are coming both from the patient's perspective, but then the caregivers. There's an enormous amount of burnout in the provider world. There's also amount of burnout in future doctors and nurses. They don't even want to go into the field anymore. So we're sitting at a big crisis that's coming up. And how do we fix that? And what do we, because I think we're going to be in trouble.
Yes, for sure.
Yeah.
There will be a big crisis if
Hmm.
they will not solve right now. Here in Canada, there's a lot of system or uh, healthcare project of the government just to uh, let the people in this industry. So, Ms. Marisa, how can provides improve the way they communicate and connect with patients?
I think it is at different levels. It is at the actual patient interaction level of having that empathy, that compassion, while you're actually just taking care of a patient, sort of that one to one. But then goes bigger into how do you bring patients into your clinic work, your redesign meetings, your policy meetings, how you're writing your patient education, how you're designing your websites. Um, that can go into so many different areas of hospital care, of um, your home care, your long term care. How are we bringing people in at every single level? And not just at the end to say, hey, we created this wonderful website. We think our patients are going to love it and give us a stamp of approval. It's the let's get them in the beginning, the concept of here, we're going to redo our website. What's important to you? What's important to patients?
Let's talk about exploring the patient experience. What were some of the most shocking or eye-opening stories you uncovered while
Mhm.
writing this book?
So a lot of them, sadly, are my own. um, and this was it got worse during COVID. I think we're going to be in what we uncovered a lot of what happens. And so this will be the long-term care scenario that my son ended up in, and he was in a group home. And during COVID, there was a lockdown. Now, my son is very medically involved. He has a feeding tube. He is also not able to speak. He has autism, pretty severe autism, and severe developmental delays. So he operates kind of at like a toddler level. And I used to just visit. all the time, once, twice a week. And COVID came and it was shut down. No visitors to any long term care facilities. And I was totally compliant with that. We didn't know what this disease was. My son doesn't have much of an immune system. It was terrifying. So I went by the rules basically. And what happened was I could not see him. This turned into weeks, months. This went on for 14 months, over a year. I couldn't put eyes on my son to know if he was okay. And what happened was that there's like a moratorium on group homes. So this is important because if I were to go and take my son out of the group home, the rule was you could take him out during COVID. They weren't saying I couldn't do this. I could take him out, but he would lose his spot in this group home after 1 week. But I wasn't allowed to bring him back for 14 days because of COVID. And we had already been on, because there was a moratorium in place and there was minimal amount of group homes or 24-hour assisted living in the state of Minnesota, that you would lose your spot. And he was on a waiting list for 2.5 years just to get an opening anywhere. So I didn't want to risk his spot in this home because he actually liked it there. But what happened was, because he had severe medical neglect during that time, he never got COVID, but what he did get was an ear infection, and an ear infection that was left untreated. And they tried to get it treated through virtual care, which you can't do for an ear infection that won't heal. You need to know what bacteria is growing or whatever. You need to actually go to a clinic. And my son, because it wasn't treated properly, finally, when I was able to see him, immediately had to go to the hospital. And because he had severe drainage coming all the way down his neck and everywhere. And what we discovered was this ear infection had spread so bad that it had gotten into his skull. His skull bones started to deteriorate. He could no longer move his eye anymore. That infection spread to his whole face. And he is no longer, to this day, he can't move his eye. And he also is permanent hearing loss in that ear. And during COVID, there was these public emergency orders where no liability for any kind of long-term care home during COVID. It doesn't matter if something happened during COVID. It doesn't matter any abuse, neglect, maltreatment, anything like that. You could not take action against a long-term care facility during a public health emergency. So this happened across the country, where people lost their loved ones, not due to anything that happened to COVID, not to COVID at all. It's usually to neglect, to medical neglect, some abuse because of short staff, all of those things. And there was no accountability, no liability for all of these patients and families that suffered like my son did.
Well, Miss Melissa, sorry to hear that. So let's talk about the personal impact and insight of the book. Did you draw from your own experiences as a patient, advocate, or a caregiver while writing this book?
All of the above. I took the direction of, each chapter kind of takes on a part of the medical system. So I talk about, like, there's a section on emergency care, there's a section on long-term care. And I wanted the first half of every chapter is, what did me and my son experience? So some of those stories. And it kind of gets the reader interested, because maybe you're just, doesn't, this part doesn't even affect you. I even have a chapter on medical records. And you think, well, how can you write a chapter on medical records? Well, a lot of things happen during documentation parts, and then our transfer from paper to the electronic record. I have serious issues with that. And so talking about how legitimately medical records affected my son's health and care. And then I go into, it gets you kind of interested about the topic, because you're following this little boy's journey through it, and you got to know him. So then it's like, well, why are medical records a problem? What should be done about it? And then I go into the system of why we went to electronic records, all of the rules. I talk about HIPAA and the appropriate uses for HIPAA, because there's some people that use our privacy laws as an excuse, and that's what HIPAA is our privacy laws. And it's an excuse maybe to not give you your medical records. So it kind of talks about that. So yeah, each chapter goes through our personal story and then goes into the actual system, because I never, in this entire book, I never call out a provider, a clinic, a hospital, nothing, because this happens across the country. It is not, believe me, I thought there was a time where I was like, this is just happening to us. We have horrible luck. And that is definitely not the case. It happens across the country.
All over the world too.
Yeah.
So, Miss Melissa, as an author, what will be your short-term and long-term goals?
I am hoping to get um, uh, basically a call to action to get people to care about this before they become a patient. And usually you wouldn't go out and read a book like this if you weren't, if you're not a patient and you don't live in this system. But I want people to understand that there's the long-term care system that's looking maybe to put a relative into long-term care. And what does that look like? Get yourself prepared, get yourself, learn about the system, and then how to learn how to properly advocate. Advocate is not a matter of going in and screaming at someone until you get what you want. There's a finesse to it. You have to work with your providers and come at it more of a partnership. And then the second is to just educate our entire healthcare system, the provider side. So maybe this is medical education. These are schools that say, pay attention to the patient experience. And this is a book that will show you how a patient is not only going from a clinic to a hospital to home care, it's learning about that whole journey. So this book is also for that, for medical education and people and policymakers.
And thank you for sharing for that, Miss Melissa. Thank you for the knowledge that you shared, and good luck for your goals. And what would be your advice for those people out there want to be like you?
Mm-hmm. One day at a time. And also look at, how do you prepare yourself? How do you educate yourself? That is very important. And then I tell every single patient, document everything, record conversations, everything that you're going through medically as a patient. Bring a friend. Our brains can only hold so much information, especially if you get bad news. And always, and then afterwards, when you're well, look at your experience and say, what could have been better? That's when I want people to step up and say, hey, this is what happened to me, especially if it was a negative experience, and think to yourself, I'm not going to let that happen to anybody else. That's what I've done, and I'm hoping others will do the same.
Yes, thank you for your advice, Miss
Mhm.
Melissa. So let's talk about looking ahead. Are you planning any follow-up books or projects connected to Who Cares?
Right now, it's just this book. I'm hoping to get a conversation started. And so I have my website is www.whocaresbooks.com. Books with an S, who cares, books.com, and hoping to get a conversation going, because I don't think there is an outlet for patients to talk about their experiences in a safe place where their care won't be jeopardized. So that would be one thing. And the next thing is that my book, because I know how important it is for people to have different avenues to read a book. So I have an audible version of the book will be coming out at the end of May as well, for those that prefer an audible version of a book.
Yes, indeed. Congratulations, Miss Melissa, for doing the audiobooks. Are you doing by yourself or you hired someone to do it?
Mm-hmm. It is just me. Yeah, just me
Mm.
going through this. So yeah, and of course still caring for my son. I live very close to him now, so I can see him all the time, and a full time job, but doing a lot of advocacy work across the country. So we need more advocates like myself. I'm hoping people will read this and say, I'm with you. Let's do it. Those
Yeah,
are who I want to work with. Yeah. Let's make this
let's
better.
yes, let's do it and empowering each other. So, Miss Melissa, before we wrap up our discussion for today, I'm inviting you to please do listen to my other podcast, people, because Abstract Essay is already in fifth season, Abstract Poetry in second season, and Book 101 Review in its fifth season, Comedy 101 in its second season, and Food 101 in its fifth season as well. Geography 101 and Love Letters are on fourth season, and Mental Health 101 is my baby podcast right now, and Movie 101 Review and Music 101 is in its fourth season as well. Science 101 and Sex 101 in its first season, so please do listen to them wherever you listen your podcast. Miss Melissa, if readers walk away with only one takeaway from your book, what would it be?
To speak up. You have a voice, whether it's happening right to you as a patient right this minute, or this is after the fact that you had an experience. Just always speak up. There are people coming up behind you, and changes need to happen.
Yes, indeed. Speak it up, people, and don't be afraid. So, Miss Melissa Winger, thank you so much for sharing your book to the world. And we are hoping for more and more and more empowering books like this to come. So, can you please invite our listeners to support your book itself? Miss Melissa, where they can buy their book?
My book is available at barnesandnoble.com, and it is also on Amazon.
Yes, where books are sold, people. Let's support Miss Melissa Winger, because if you support her, as I said, more and more and more empowering books like this to come. So, Miss Melissa, thank you so much for your time.
Thank you.
And looking forward for the audiobook. More to come, people.
Yes.
See you soon.